Hello, I'm Kerry Redican. I'm a professor of public health at the Department of Population Health Sciences in the College of Veterinary Medicine here at Virginia Tech, and we offer a Bachelor of Science program in public health. And I'll tell you the why we're located in the College of Veterinary Medicine in a second, but let me just kind of go ahead and at least set a little bit of a context to some of the things that we deal with. When we talk about some of the major problems that we're facing in this country and in the world, they are public health problems, whether it's food safety, whether it's the opioid epidemic and other drug-related issues and so forth, whether it's overpopulation, congestion, air pollution, cigarette smoking is still a problem, tobacco use, misuse, and abuse, water safety is important, and even into climate change. And this is but a few, all right, of the public health problems that we have in this country and in the world. And I know you hear about these things in school and at home and in other community venues and so forth. And of course, the reason why I'm here now, talking to you virtually and not in person, is because of the coronavirus, what we call COVID-19. And the coronavirus is a virus that is now spreading worldwide, as you know, and is particularly dangerous, and it's a problem that the world literally is facing. And we have a lot of implications of this virus in terms of our time and so forth, and how we spend our time, and why you're probably not in school right now and listening to this particular presentation. So hopefully as this passes, we'll have more of an opportunity to meet face to face and go over some of these things and answer any questions that you might have. But still, again, talking about the COVID-19 pandemic, the solution to this is public health. The solution is public health, and you know, no matter how much we can do in terms of medicine, we don't have a vaccine yet. We have some issues with our testing, as you know. But through public health efforts, the social distancing and things like that we're doing, washing our hands regularly and using some of the disinfectants and so forth, this is very, very important in terms of preventing the spread of the disease and what they call flattening the curve, because we know this virus will work its way through our society. But through what we do in public health, what we learn about in public health, what we call assessment, policy development, and assurance, this is the way that we're going to tackle this problem and all of the other public health problems that we deal with. And just very, very quickly, not to get too lecture-ish, if you will, but when we look at public health, we have what we call core responsibilities and essential services. The core responsibilities are assessment, policy development, and assurance. And really, if we apply this to the coronavirus, right? We're talking about assessment. We're trying to find who tests positive, who has the disease, what are the symptoms, all these kinds of things. They're going to be more data-driven. We look at how that translates into policy, what we're supposed to do about that. And then when we have those things in place, the assurance, how do we prevent it from spreading? How do we prevent it from reoccurring? All of these kinds of things. And this is what we do in public health. Maybe not all three, but depending upon what career you choose in public health, you'll be doing maybe more on the assessment side, more on the policy development side, or even more on the assurance side. And this comes to why we're in the College of Veterinary Medicine. We have a Department of Population Health Sciences in the College of Veterinary Medicine, and that Population Health Sciences is really more the human side of medicine. And the College of Veterinary Medicine is an excellent college to be in, because if we think about something like communicable disease, infectious disease, about 75% of infectious diseases are what they call zoonotic, can be transmitted from animals to people. And so to better understand the health of human populations, you really do need to understand the health of animal populations. And so in a sense, being in the College of Veterinary Medicine is quite strategic for that more comprehensive approach to dealing with the human condition. And we're not training veterinarians in the Bsph program, but we do, in fact, through our coursework and so forth, you gain that bigger, more macro, more comprehensive appreciation. We strictly are human medicine, human public health, and so forth. So don't let being in the College of Veterinary Medicine fool you in any way. Let's talk a little bit about what this experience will be like in terms of the Bsph. We have basically the general Bsph curriculum, Bachelor of Science in Public Health, and included in that are foundations of scientific knowledge, so the biological and life sciences, concepts of health and disease, again, that big picture there. We also rely very heavily on the social and behavioral sciences. what health behavior is all about, why do people behave the way they do, and so forth. We do need to talk a little bit about data, so we have some basic statistics in terms of the program, in terms of that orientation. And of course, in any comprehensive college education, there are important applications of the humanities and fine arts, yes, even to public health. So let's talk a little bit about that public health content more specifically, which makes this literally a major in a program like in a college like Virginia Tech. In the Bachelor of Science in Public Health, the public health content that you'll go over will be public health history, philosophy, core values, and so forth. We'll talk about data collection, use, analysis, importance of evidence-based approaches, health and basic approaches, interventions to identify and address population health concerns, the science of human health and disease, socioeconomic, behavioral factors, and so forth that are predisposing, enabling, reinforcing factors with respect to disease. And if we talk a little bit more, project implementation, evaluation, assessment, and so forth, characteristics of the U.S. health system and the differences between our system and other countries, again, a very important issue, and legal, ethical, economic, regulatory dimensions and roles and so forth in public health. And again, we're talking here really about the content that is spread out through the core courses in the public health program. And then finally we talk about health communication, technical, professional writing in this. So you get very much a very broad degree that you can apply to many different areas in public health and transferable even to other related occupations and so forth. So if we think of the typical undergraduate degree at Virginia Tech, no matter what undergraduate degree you pick, it really contains primarily 4 components. One is the pathways components, which is about 45 credits, and that is more your general education. We call it pathways because it's got more of a focus to it and more of an intentional purpose to what you'd be taking in what areas and so forth. But that's getting kind of ahead of ourselves for just an orientation presentation like this. Then you have your major, which are the public health and related courses, and that's 45 credits. And then mostly tracks and so forth, the concentrations in that's about 30. And the total for most majors is 120 hours, right? So if we look at the Bachelor of Science applying that formula, we have 120 hours. 120 hours or credits that really compose the degree, pathways being 45 of them, public health major is 42. And one of the things that makes this program really attractive and unique is that we have 33 hours of free electives. And I'll explain why that's important here in a few minutes. The undergraduate courses that we have are in environmental health, they're in health behavior, health communication, medical sociology, program planning evaluation, epidemiology, and nutrition. So all of these really, there's a couple of courses in most of these areas. This represents the public health major related courses. Again, gives you that overview, that general exposure to public health and related areas. If we look at that in terms of our check sheet, which you'd find again on our website and probably found, you see the pathways courses, the 45 credits there. You see those public health courses that I just went over, and then you'll see the free electives, which is 33 hours. The beauty of the free electives is we can basically use those electives to help you get the job you want when you graduate. So really we are very much occupation oriented, professional position oriented, and what we will do with you is we will develop a career development plan when you're here working with us and working with your advisors. And so when we look at what it is you want to do and we look at it as what we have you take, we use those elective hours to in fact position you well for employment in that area that you want to be in. So it really does add a lot of value in terms of that. So for example, if you choose to go on to one of the professional schools, medical school, dental school, veterinary medicine, and so forth, we can use those free electives to fill in those sciences that you need for those particular programs, right? And then be eligible for the programs. So for example, if you want to do public health in South America, that's your passion, well, we would probably use those 33 hours of free electives to have you take courses in South American culture and South American maybe minor in Spanish or whatever it may be. So we can position you very, very well using those hours. We don't lock you in to specific tracks and so forth. And again, we really are very, very proud of our advising and career development plans and so forth with our students. And then job opportunities in public health are many. Epidemiologists, public health nutrition, public health nurse. Some of that would require additional training. For example, many of our graduates would go on to nursing school and so forth. Environmental health, public health educator, health statistics, vital statistics, and so forth. All these are job opportunities in health, and there's a lot of job openings out there. The market for these particular positions, the wide array, is very, very good at this point, and probably will continue to be good for a long period of time. So you have a good opportunity here to work on a major and to graduate with a major that is readily employable and has a lot of transferability to other occupations and so forth, depending upon how you use your free electives. Okay, some other options, related types of options. You know, one is an accelerated degree program. We offer a Master of Public Health program, and we have an accelerated option for that. So what that would mean is that the second semester of your junior year, you would apply to the Master of Public Health program, and if accepted, several of your undergraduate courses would be taken at the graduate level, and they would in fact be counted as both the undergraduate and the graduate degree. So it's a really nice option. And what that means is you would stay 5 years and get a bachelor's and a master's degree. So that's a very, very attractive option for many students who have definitely decided they want a career in public health and would probably at some point need to get the Master of Public Health. You can get both of them in a 5-year period of time, which makes it nice on the accelerated program. We also offer a public health minor and a number of courses there I'll show you here in a second. That's always another option for students. And there's our Master of Public Health degree. Very quickly I'll talk to you about that, because many students even are thinking, even as incoming freshmen, about graduate school and so forth. Our minor really contains 18 hours that sort of gets at the core of what it is we're trying to do with our undergraduate coursework. And the minor will help position a person for graduate level work and even some of the occupations and so forth that they have. For example, they're majoring in something else like human nutrition, foods, and exercise, and they have the public health minor. That's helpful as well for them. And then finally, when we talk about the Master of Public Health degree, that's a 42-hour degree experience, a 2-year experience. With the accelerated program, we cut that basically down to 1 year. And again, you've got very similar kinds of courses at the MPH level that you would at the BSPH level, only they're going to be a little bit higher, more conceptual, more theoretical, and so forth. But again, that's getting down the road, but many students think about this early on in their undergraduate years. If you want to learn more about the MPH program and the BSPH program, we have a website there. You can click onto that and learn more about it. And if you have any questions regarding the programs and opportunities and so forth, feel free to contact me. My contact information will be at the same link there that you had gotten this, this particular presentation. So I thank you for taking time to listen to the presentation, and I hope next time we can do things in person and not have to work in this virtual environment. Again, if you have any questions, feel free to contact us. Thank you.